This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
It is the gift that keeps on giving. Our sense of sight allows us to appreciate the world around us. They say that the eyes are the window to the soul, when the cornea is the window of the eye.
The main function is to protect the eye from any trauma or injury.
The problem arises when the cornea is damaged because of injuries and infection. Vision is severely reduced because of glaucoma, keratoconus, or when the cornea bulges outward, or because of complications due to a cataract surgery. To restore vision and to alleviate pain, a cornea transplant is vital for someone with a damaged cornea.
It is a surgical procedure that replaces the damaged cornea with healthy cornea.
The important thing is to find a suitable donor that do not have infections yet or other communicable diseases such as hepatitis and HIV.
The success of corneal transplant actually is very high, and improving the vision is really excellent.
What other conditions require a corneal transplant? Who can be possible donors? How long will it take for you to recover your eyesight? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Mingita Padilla, the president of the Eye Bank Foundation of the Philippines. She's also a clinical associate professor of the University of the Philippines, PGH, and also an active consultant of the Institute of Ophthalmology of the St. Luke's Medical Center, Global City. You may join the discussion by calling our hotline at 548-4678. Good evening, Dr. Mingita. Welcome to MedTalk.
Good evening, Angel, and I'm happy to be here.
The pleasure is ours, Doc. The cornea.
Yes.
How do you explain to us the importance of the cornea and its role in vision?
Okay. May I use my model
Of course,
eye?
yes,
because
please.
It's hard to explain without the model.
Go ahead.
So, the cornea is the first refracting surface of the eye. When you look at an object and you want to see properly, light has to enter the eye. The eyelid is what protects the eye, remember? So we have an eyelid, so when you're threatened by anything, you tend to close your eyes.
Yes.
Because it has to protect your eye from getting hurt, okay? The cornea is the main first glass or first window, as your segue said, through which we can see. But the cornea has to be clear, has to be normal in shape without any disfigurement in order for the light, when it enters, to focus properly, to focus. It's the main focusing surface of the eye. So anything which can cause a scar, anything which can cause a swelling or a disfigurement, like a change in the shape, will already cause blurring or functional blindness. Okay, so that's basically it's the main refractive surface of the eye, which bends light so that we can see properly.
And in seeing properly, what should we see? How should we see? What is a healthy cornea?
No, the cornea itself, if you have a healthy cornea and you don't have a grade, that's different.
Okay.
Having a grade, you can still have a healthy cornea, but you need eyeglasses. That's fine.
Okay.
It's still, your cornea is still healthy, except the shape is such that maybe it's too steep, and you are called a myope or a nearsighted person, because when you open up the eye, and then here, see, when you open up the eye, and I don't know if you see the side view. Okay,
there
great,
you go.
there.
Yes, yes, Doc.
When light enters the eye, and it's a normal cornea, a normal lens, this is the lens inside, which becomes cataract inside the eye, it should focus on the retina. If your cornea is too steep, then the light will focus in front of the retina. You're nearsighted. You need glasses or contact lenses to weaken it so that it will focus properly.
Okay.
See, if the cornea is too flat naman, it will focus behind the eye, still out of focus, and you're a true farsighted person.
But that's still a healthy cornea.
It's still a healthy
Even if
cornea.
you're
You just need
nearsighted?
glasses or contact lenses. Okay. A cornea is truly unhealthy. So if you have a healthy cornea, you just need glasses, you wear the glasses or the contact lenses, you can see.
Yes.
Okay. If you have an unhealthy cornea, on the other hand, you can either have a cornea which is abnormal in shape, like keratoconus, for example, wherein instead of being a smooth sphere, it becomes like a cone. Okay? And you also cannot see properly because it cannot focus light properly. It becomes distorted, no? It can start out as a astigmatism, which gets worse and worse and worse and becomes irregular. It can be a sign that you're developing what we know as keratoconus. Also, if you have scars in your cornea, for example, you get hit by glass, you get hit by foreign objects, or else you get an infection from improper use of contact lenses.
Oh,
then that
okay.
infection heals, but then you develop a scar. Or else you can be born with it. Or you can have dystrophies, which has gradual deterioration of the cornea because abnormal deposits from your body, you cannot metabolize it properly. They deposit all in the cornea, so it becomes white. Earlier you said to me something like bilasang isda.
Yes.
No? Abnormal corneas can look like that. They're whitish instead of crystal clear.
So that's like
a normal cornea.
a sign that your cornea
Oh yeah,
is damaged
definitely.
already.
That's already far gone damage. If you look at the cornea, and it's very white. Because sometimes the naked eye cannot really discern if the cornea is damaged. Okay, but you have to use a microscope or a slit lamp, special instruments. But sometimes it's so bad that just looking at the
It's
person,
so obvious
it's so
already.
obvious. Puti na ang mata niya. No? So that is, there are many types of diseases which can cause damage to the cornea. But all of them lead to blurring.
Blurring
Very,
vision.
very blurred vision. Yes.
You mentioned there are different types of diseases that can lead to the cornea being damaged.
Yes,
What are
damaged.
these diseases, doctor?
Well, in the Philippines,
most common, right?
yeah,
The
in the
most common
Philippines, the
ones.
most common diseases which lead to corneal damage, which require transplants, no, are infections. Okay, that's why I'm talking about contact lenses because there was a time so many of our young people were using these colored contact lenses.
Yes. What is
and-
your take on that?
Okay. Colored contact lenses, but what made it really bad was that they were buying the very cheap ones and they were sharing pa. They were sharing contact lenses. So that's really bad. It's like sharing underwear. We told them, ano mo, hindi ito bag o sapatos o
Na
bag
pwedeng
na pwede
hiramin
mong
lang.
hiramin. Ha?
Yes.
Contact lens is a very intimate thing because all of us have our own set of bacteria that lives in our eye. They're okay with you, but they will be okay with others. All I'm saying is that do not share contact lenses. Colored contact lenses, you buy the good quality. Okay? Not yung mga mabibili mo lang sa bangketa. No?
Right.
Very thick, sometimes irregular or rough. And we've seen many infections. And the infections are so bad that they can lead to scarring and even perforation of the eye, of the cornea. Then wala na. It's very difficult to save. So infections. Another growing reason for the need for transplants is complications after cataract surgery. Now, cataract surgery is the most common eye surgery done in the whole world, okay? But sometimes, if the cornea is weak to start with, and if it's a difficult surgery, sometimes the cornea can get damaged.
Okay.
Because that's another reason. Another one naman is trauma. Very common. Acid, alkali, lovers quarrel, they throw acid, very common. Then, yung mga shrapnel, glass, explosions, firecrackers, all of that will damage your cornea. Okay? So, during New Year's Eve, we get a lot of corneal problems kasi nagpapaputong, natatamaan ng mata. And then genetic and congenital. Some babies are born with white corneas, no, genetic diseases. And then there's also dystrophies. Dystrophies are diseases of the eye which gradually they have abnormal composition, the cornea. They develop nga deposits which should not be there with time. And there's also degenerations. No? Sometimes the inner part of the cornea gets weak, and then suddenly, because it's weak, it cannot pump out water, the cornea gets thick and thick and thick and thick. It gets white also. Okay. Then you have your mga keratoconus, which are called ectasias.
So that's a degenerative.
It's an ectasia, meaning the stroma of the cornea, the central part of the cornea is weak. So in time, the shape, it becomes like a volcano, like Mayon volcano, because it's weak. It becomes ectatic, it bows out. So again, you cannot see properly. Okay, but now we have solutions to that other than a corneal transplant.
Okay.
For keratoconus.
And keratoconus, does it have anything to do with astigmatism or nearsightedness and farsightedness?
Yeah, okay.
Are they one and the same?
No, they're not one and the same. That's a good question because astigmatism simply means that your cornea is not even all around. Some parts of it are steeper than the other, okay? And that's why when light hits it, it's sabog. Some of the light is reflected here, some it's reflected here, kasi hindi siya even, hindi siya pantay. Pero kung magsalamin ka, you wear glasses or contact lenses, okay na yan. With keratoconus, it may start out as astigmatism. You notice an astigmatism, but it keeps changing, getting higher and higher and higher until a point na you cannot anymore get a good grade with eyeglasses. You cannot correct it anymore with eyeglasses. Then you have to suspect that you may have keratoconus. Because what happens in keratoconus is that the cornea starts to, again, we look for the angle here. The cornea starts to bow out, meaning instead of like that, it becomes like a volcano. It starts to, little by little, extend forward because it's weak.
What causes the extension? What causes
Because
it?
it's weak.
Okay.
It's weak. The stromal cells are weak, so it cannot maintain its shape. So it's like a,
Parang
lupay-pay.
yeah,
It's like,
yes.
It becomes like maluwag na. There's nothing to keep it
No
strong.
elasticity anymore.
Yes, or
Is
no
that the
strength.
proper word?
No
Strength.
strength of the cornea. And that's a genetic defect that can run in families, but it's aggravated by rubbing and rubbing the eyes. Those with allergies keep rubbing their eyes, and they have this tendency, it can aggravate this and make it come out.
Okay.
No?
So when we keep rubbing our eyes, sometimes I must admit it's nice to rub our eyes.
It's itchy,
and
especially, no?
when it's very itchy. But knowing that it can lead to something like this,
It can be. Let's put it this way. It's one of the factors that are linked to keratoconus. Almost all our patients have histories of allergies and rubbing their eyes, and many of them have like mestizo blood. But we're seeing more and more now without. Talagang very native Filipinos, more and more now coming out with keratoconus. No? The good news is that if you catch it early, and this is very important, if you catch keratoconus early, we can do something which will not require a corneal transplant anymore. Before, all we could offer the patient was contact lens, and then eventually, when it gets really bad, transplant.
Yes.
But now, when we diagnose it early enough, we can do what we call cross-linking. It's a simple procedure. It takes about an hour, outpatient, wherein we drop some special vitamin B drops into the cornea and expose it to ultraviolet radiation in order to strengthen the cornea so that it will halt the progression. It will not anymore become like a volcano and bow out. No? And that will prevent the need for transplant in the future. But importante, maaga.
so ito
See
yung
your
mga
doctor.
na-diagnose na may astigmatism.
No. Or irregular astigmatism.
Irregular
Or if your child, especially it starts coming out in the teens. No? If your child keeps having new glasses, astigmatism keeps getting higher and higher and higher, you suspect there might be something like this. You see already an ophthalmologist or maybe a cornea specialist, not just an optometrist na lang. Or sometimes the optometrist will tell you, may problema na yata, maybe they'll refer you. If you have a good optometrist, they will know when to refer to an ophthalmologist for these problems. Because the earlier, the better. So you can avoid a transplant.
Oh, when they're young and you notice, like what you've mentioned, no? You notice it,
keeps changing so fast, no? The grade. And then you cannot anymore get a good grade. Kasi irregular na masyado yung grado. No? And even if you put glasses, no matter what glasses you put, it's still not that good anymore. So, but even don't wait for that. If it just keeps changing, see an ophthalmologist, no? Okay?
And in seeing the ophthalmologist, hopefully it doesn't lead to more damage to the cornea if you keep delaying.
Yes, and we can do something sooner.
Okay.
Sooner, para you don't need a transplant anymore in the future.
Okay, you've mentioned the transplant, so you don't need a transplant anymore in the future. But in the event that one does need a corneal transplant, we'll discuss that when MedTalk returns.
Did you know that Herminiano de Ocampo was the first Filipino to design a corneal dissector manufactured in the US? He was also responsible for introducing corneal transplant in the Philippines.
Different. We're back here on MedTalk, still talking about corneal transplant. Dr. Minguita, before
Yes.
we cut to the break, we were talking about, you were explaining to us the cornea, keratoconus,
And
and
if you can cross-link it or treat it early with certain new technology, you can avoid a transplant. But for certain diseases, for example, what diseases need a transplant?
Yes,
I was
please.
explaining to you kanina, no? Like, for example, what happens during a transplant is that, again, can I please use this model?
Yes,
so
please.
if you close this eye again, okay,
There.
close it again, the front, no? So this is the cornea. The traditional corneal transplant is a through and through. You, like a cookie cutter, we cut through the cornea, a central portion, maybe about 7.5 millimeters of the sick cornea. Imagine this cornea is white, bilasa, no, because it's diseased, it's
Yes.
not normal. You cut through about 7 millimeters or 8 millimeters of the central cornea, which is abnormal.
Okay.
Remove it. Then from the eye bank, we will source a fresh, healthy cornea, which you were looking at earlier, they were showing. And then we'll cut that also with special instruments to fit into what we removed and suture that into place. So it's pretty straightforward. Okay, and you can use that to treat scars, infections, etc. But nowadays, because of technology also, we can choose also to replace just the inner portion of the cornea or just the outer portion of the cornea or the entire corneal thickness, depending on the disease. Okay? So basically, it's replacing a sick cornea with healthy tissue. That's basically what it is. Okay, and it's
Doctor-
done with surgery.
Doctor, I didn't mean to cut you, but we have a caller on the line.
Okay.
Okay, we have Brix Dizon. Hi,
Yes.
Brix. Good evening.
Hi po, good evening.
Good evening. Question mo para kay Dr. Minguita. Yes, Brix.
Hi,
Hi, Brix.
good evening. Good evening po, Doc.
Yes.
Actually, recently po nagkaroon po ako ng keratitis.
Keratitis, okay.
Tanong ko lang po kung meron po ba siyang long-term na effect po dun sa vision ko or dun sa eye ko po. Nagkaroon po ako ng keratitis sa left eye po.
Okay, it depends how bad the keratitis is. Keratitis means an inflammation of the cornea. Brix, was yours due to an infection? No.
Nagka-sore eyes po ako and diagnosis po sa akin ng mga ophthalmologists po.
So, nagka-sore eyes ka, tapos yung sore eyes mo, nagkaroon ka ng konting panlabo, ganun ba, afterwards?
Opo.
Okay.
Ang tagal po niya, mga 1 week po siya.
Pero nawala na, nawala na.
Wala na po siya.
Okay.
And ngayon po, eye gel po ako, eye gel.
Okay.
Ang
Yeah, I got your question kung may long-term effect siya sa vision mo, ang tanong mo. Okay, so that's a good question because sometimes sore eyes is actually conjunctivitis, inflammation of the conjunctiva. The conjunctiva is the parang transparent lining of the eyes, of the white of your eyes.
Okay.
The cornea is what covers the black of the eye, the iris, okay? So if I look at you, I'm looking at your cornea and your pupil is in the middle. So
Yes.
the cornea is transparent. Around it, it's white, diba? That's the sclera or the shell.
Yes.
That is covered naman by a parang cellophane called the conjunctiva. When you have sore eyes, it gets red. That's because it gets inflamed. The blood vessels get dilated, galit na galit yung blood vessels. That's conjunctivitis. Sometimes, however, there are some type of conjunctivitis that also affect the cornea. When the inflammation is going down, the cornea gets a lot of white deposits. So the vision blurs, namamaga yung cornea. It's called keratitis. If it's because of conjunctivitis or sore eyes, that goes away in time. And it doesn't really usually cause any permanent damage. Okay? So Brix, don't worry. Walang permanent damage, especially wala ka ng problema. However, if the keratitis is because of other infections like bacterial infection, like that, I was talking about contact lens related, no? That's also keratitis, but it's microbial infectious, meaning it's caused by a bacteria, and that can cause permanent damage. Okay? Pero yung gaya kay Brix na galing sa sore eyes, okay lang yon. At this point, he's fine. He's safe.
Okay, siyempre, nakaka-nervyos yan,
Siyempre,
ano?
yeah, oo.
Na you have sore eyes and then it lasts for a while.
It can last for weeks. In fact, we have mga sore eyes now that can last for months.
What?
Yes, it depends on the variety of the virus you get. And there are some viruses now that are so virulent and so bad.
They stay with you
They stay
for
with
a
you for a
while.
long time.
Yeah.
Especially I have people from Bangladesh, from India, they come here, they're getting better, they act up again. And it's iba-ibang klaseng viruses now, they're mutating, no? They're getting more virulent and they can last for months. Yeah.
So, Bricks, you should be fine.
You're okay, Bricks.
Thank you for
You're
calling.
Okay, yeah.
Okay, he put it down already. He's
Yes,
ready
I
to
know.
watch and listen and learn more.
Okay.
So, doctor, a little bit about the sore eyes, no? Because maybe not only Bricks, but others are equally worried that
Yeah.
it might affect their vision.
Yes.
Long-term side effects maybe of sore eyes that didn't get well.
It's very, very rare that you get, because sore eyes is because of a virus, which is self-limiting. Eventually, whether you put medicines or not, they will go away, like the flu. We just have to support. However, there are really some that are so virulent, they can cause like bleeding, they can cause what we call membrane formation or pseudomembranes, na parang your muta is so thick na dumidikit na siya sa ilalim ng talukap ng mata, no? And it forms like a film na talagang ang labo-labo, tapos maga-maga, and it can also cause keratitis, meaning inflammation of the cornea, depending talaga on the variety of the sore eyes you get. No? Most often, it will go away, even that. But the blurring of vision occurs after the inflammation usually is gone or less, and that can last long, weeks to months. But it will go away.
Okay.
But we will give you medicine, like he's on a gel, to sort of help heal it, no? Remove the inflammation. They'll usually give you gels for that. But it usually just goes away. But it can be such a pest.
It's a hassle.
It's a hassle talaga. Kasi muta ka ng muta, hindi mo buksan ang mata mo, masakit. It's really hassle, no? And it's very contagious. So very, very contagious. Okay, so always wash your hands. Don't touch your eyes and touch somebody else. Okay, always wash your hands. Okay?
So
When you have
proper
sore eyes.
hygiene when you have
Proper
sore eyes.
hygiene when you have sore eyes. Yeah.
Doctor, how about the conditions? So let's go back
Okay,
to
go back to-
understanding the corneal transplant.
Okay.
Conditions that may require an individual to undergo a transplant.
Well, as I said, usually maybe infections, abnormalities in the shape of the cornea, or complications of cataract surgery. No, can do that. No, it can weaken the cornea. Genetic diseases. There's so many. So many things.
Youngest patient, doctor, that
That I've
you've
ever done?
encountered, that you've ever done because of a corneal transplant. You mentioned also
6
genetics.
months old.
Okay.
It can be a congenital anomaly where you're born with a white cornea, or we have a what we call certain dysgenesis. It doesn't develop properly, the eye. So we do them early so that they can be given a chance to see. And the oldest patient I've ever done a transplant on was 88. So 6 months and 88. So age is really not a it should not stop you from getting a transplant. Okay.
And what happens during the transplant, doctor? What is
Okay,
the
so as I said,
procedure?
we usually do the transplant. You can either do it under local anesthesia, under sedation, or general anesthesia. I usually prefer to have the patient sleep, so I don't have to worry about the patient moving.
Yes.
Okay? Because it can take some time, depending on how difficult the case is. A straightforward transplant can be less than an hour. Or an hour and a half, no? A more complicated one where you do so many things like cataract or many other things can take longer. Usually I just admit them the day before and then discharge them the next day. No? With a straightforward transplant, if everything goes well, usually after the transplant you can see much better than you did prior to the transplant. But there's a period wherein there's what we call the fine-tuning. Because you suture the cornea in place, and then it takes time for that cornea to take. It's like planting a plant. You have to wait for it to take. And then little by little, the vision gets better. And then we remove sutures selectively until we can give you glasses. Or if not, no glasses at all. No? Depends on how it goes. That's for the traditional corneal transplant. As I said, we have transplants that we don't even need sutures. It's just inside. No? But that's a different, no, it's hard to explain. We use air to... We transplant like a very, very thin, 120 micrometer thick layer of the cornea into the eye, and then we just put air, inject air, and it sticks.
Wow, okay.
Yeah, it's called the endothelial keratoplasty. It's a more high-tech type of transplant.
This is also done here in the Philippines.
Everything I'm discussing is done in the Philippines.
Oh, okay.
We're doing it already here.
And the eye bank of the Philippines is, of course, hand in hand.
Of course, without the eye bank, you cannot do transplants.
Yes.
That's what many people don't realize. And because we can have the best surgeons, we can have the highest technology, but there's still no replacement for the cornea. There's a lot of research going on. We're trying to see stem cells, diba? They're trying to do bioengineered cornea. So little by little, hopefully, we will have a substitute soon, no? But in the meantime, there's none yet. Wala pa. So we still need the goodwill of people to donate their corneas. No? So otherwise, others will not have a chance to see.
compatibility of those?
No need.
No need.
No need, because unlike organs, the cornea is a tissue which has no blood vessels. It's so they call it immune privileged, no? And that's why we don't have to do typing. Anyone's corneas can go to someone, Filipino, American, Sri Lankan to Filipino. We can actually do true sharing without HLV typing. No? So you don't have to match it. Okay?
Well, that's good to know,
Yeah.
because you don't have to wait anymore, unlike
Yes.
waiting for other
Correct.
organs that have to be donated.
The only reason you have to wait is that there's none.
Yes.
Not because there's no match. Okay? But the thing is, there's a need, a continuous need, an endless need for corneal tissue. And there's a waiting period of about maybe 3 months, 4 months. No? But you still get it. Unlike before the eye bank, there was none.
So how would it go before the
Oh
eye
God,
bank? How
wala,
would the procedures be?
paiyakan.
Oh my.
You could not assure your patient that they'll get your transplant. We used to get tissues from the US, but these are usually charity tissues, which are not the best. These are tissues which the doctors there don't want to use, diba? And they share.
Yes.
Or else, ano eh, it's like talagang there was virtually no
Wala.
hope. Yeah.
Yeah.
That's why now we have this, but we appeal to people talaga to consider donating, no, their corneas or their loved ones' corneas, because it's the only hope of certain people to see again.
Full recovery, doctor, of those who have undergone a corneal transplant.
You can go back to regular living, regular life. No, we tell our patients gradually it's going to get clearer and clearer, but you cannot do like full contact sports anymore.
Or drive.
You can drive later
Pwede.
on. You can watch TV. That's not the problem. The problem is yung mga carrying very heavy objects, swimming. Huwag muna magsa-swimming for about 6 months. Contact sports, we're going to have to really avoid contact sports. If you're going to do any sports, you have to wear protective goggles. Usually, I can give them glasses within about maybe 3 months of the...
What do the glasses do?
They focus so it becomes like you're just a normal person who has astigmatism or nearsightedness.
Okay.
You just need the glasses, like everybody here wearing glasses, to focus the vision. Again, no? Ordinary glasses na lang.
And then at some point, you can take those glasses away when vision is already...
It depends. Depends also on the kind of transplant you do and on the health of the cornea. You can actually even do a laser later on that cornea to
Really?
remove the grade. That's where your refractive surgery comes
Yes.
in. You're asking about LASIK,
Yes,
PRK.
yes.
You can do that on a cornea later on, even after transplant. As long as it's
amazing.
still healthy. The count
Okay.
is okay, etc., etc.
We're talking about a healthy cornea. We're talking about corneal transplant. All that and more when MedTalk returns.
In 2003, a tragedy tested Ali Soto's faith, her son's untimely death. Young and on top of his career, Miko Soto fell to his death from his condominium building in Mandaluyong City. Ali struggled to find meaning and solace until she decided to donate her son's corneas to 2 individuals.
And it's keeping with the character of Miko. Miko kasi my son is such a generous soul.
His right cornea was given to Jonalyn de la Peña, while his left was donated to Esme, a then blind girl whose father was an ambulance driver.
So at the time, she was 3 or 4. She was blind in one eye. So Esme was, their parents were telling me that, she was always, irritable. She's irritable. She wasn't doing well in school because she was blind, After she received one of the corneas of Miko, it just became a normal, happy child and started doing well in school. It just changes their lives. It makes them, happy and more confident. It just makes a difference.
Today, Ali encourages others to do the same and help by extending the life of someone else through organ donation.
Get an organ donor card to be a lifeline when the family decided to donate. the corneas of Miko, we did not lose. It gave us that comfort. We did not lose our son in vain. It gave us that knowledge that that he lives on and that his death was not meaningless.
Back here in MedTalk, still talking about corneal transplant. Dr. Mingita,
Yes.
Miko's case,
Yes.
and the immediate decision to donate his
Yes.
corneas.
That was actually hats off to Ali, no? And she became my friend after this. That's how we met, no? Because a week before Miko died, actually, I was a guest on their show in the radio with Arnold Clavio, just by phone patch, talking about the eye bank. And,
Okay.
and she was, mabuti meron na pala tayong ganito. Then they talked about it. And that's why when Miko passed away suddenly, and she was in Makati Med, and she was in such grief, can you imagine, no? But she had that presence of mind, and I think generosity of heart, that's what I call it, to think, I want to donate some. I want to donate, she told the people in the emergency room in Makati Med. And at that point, it had been some hours after he passed away na, because he had been transferred from another hospital. So the only thing she could really give at that point was the cornea. No? And they called the eye bank, and we had to retrieve it almost immediately because it has to be retrieved within the first 12 hours of death.
Okay.
Ideally even earlier, no? And so we did. And I got to talk to her after that. I met her. And I was the one who did the transplant on the child.
Esme,
yeah.
yes.
And it was featured. And Ali was so generous that she allowed us to feature the whole story. And it really created such awareness and an acceptance of it. No? And up to this day, Ali continues to help us. No? Just like now. And Miko's still one of our poster boys. So he really lives on.
Yes.
No? And people still remember his
Yes.
story. So if only more people could be like Ali. No? And she knew naman that Miko, as she said, was such a generous soul. Ang bait talaga.
Yes,
he really wanted to
is.
give.
He was,
and so,
yes.
any of you who has relatives who are giving and generous, you know, please, no, if well, that person can sign a donor card, but even without it, like Miko didn't have a donor card, but Ali knew that her son would have wanted this, diba? And there are many ways to become a donor. Even our driver's license, Angel. Many people don't know. Look at the back of your license. You can check that you want to be a donor. It's there. And nandun siya. So people don't know that. So we're now telling the police people, the SOCO, if you have a scene of an accident, please check the driver's license because that person may want to be a donor but nobody will know until you check. At yung kagustuhan, yung hiling, di ba? Yung huling kagustuhan ng tao, hindi nasusunod.
Right.
The wish of that person to give. So we have to also honor that, di ba? So we should check. We should check everything, the license, the donor cards, the wallet. Usually may mga ganun na ngayon eh. Especially the DOH is also pushing it. No? So,
And as you mentioned, it's an immediate need. So checking really is very
Checking,
vital
yes.
within the good number, 12 hours?
Yeah, well, for the cornea, it has to be retrieved
Right
within
away.
12 hours. But earlier the better, especially in a hot climate like ours. No, it's faster. The deterioration of the tissue is faster. So after we retrieve it, we can always store it in the solution for mga 10 to 14 days. But it is used before that.
Okay,
Because
it's
there's
never stored there. It's always used.
The
There's
only
always
time
someone in
the
need.
only time we store it is if the donor tissue is not usable because the donor tested positive for certain diseases.
Okay.
Because we always get blood from the donor and we check for HIV 1 and 2, active Hep B. Never mind if it's not active, it's okay, but active, then hepatitis C and syphilis. If you're positive for any of those, you cannot be a donor, but we still use the tissue for research and training. So it does not go to waste.
Okay.
It does not go to waste. That's how we train our doctors, diba? We do research. So it's still used. But we have to tell you, we cannot transplant it, syempre, because it's not safe.
It's for research.
It's
na.
for research or training, no? So it's
And-
still used. It's still used.
And
no?
speaking of, it's still used, Miko's other cornea was, you've mentioned that
Jonalyn naman. Yeah.
Jonalyn.
Yes.
The other one, Esme, was blind in one eye.
Yes,
and-
because she was hit by a aparador, the glass of the aparador.
Okay.
No? It fell on her. So these are the things, accidents, no? That can happen. I think Jonalyn naman was an infection. Measles, I think it was measles. So it can happen to anyone, no? To anyone.
And it's amazing that you don't have to wait anymore. We
Not-
spoke about it before the break that unlike other organs, that you
Not
have
as
to
much,
wait.
yeah, not as much anymore because we would like, our dream is that you can schedule it as needed. Okay, that's our dream.
How many hours after the harvest do you call? What is the process like?
Okay, once it's harvested, it's brought to the eye bank. We have a waiting list of people. So it's first come, first serve. And once it's brought to the eye bank, we do the tests already of the blood. Now, almost immediately. And as soon as they come out negative and the cornea is evaluated, we have to evaluate the cornea as to quality. We even count the cells. It's a very scientific process. And we can grade the cornea, whether it's good enough for this, not so good, you know. Then we call the waiting surgeons who have patients waiting.
So if all goes well and the transplant is in place and the how do you call the
recipient?
The recipient has undergone the transplant and everything, and she can see already after several months.
Well, she can see right away.
Right away.
But the fine tuning, the clarity gets better as the days and weeks go by.
Is there a situation where the cornea is rejected by the patient?
Yes, definitely.
What happens during
although the cornea is the most successful transplant in the world, it can still be rejected, okay? Especially if the eye, for example, is not so healthy. It's dry, very dry. If there are a lot of blood vessels entering the cornea where they shouldn't be. If you've had the swelling of the cornea too long, then it's like planting a plant in a very bad soil. What happens is that the cornea starts out clear, but then afterwards it starts to get hazy. Then that means it's rejecting or failing. No? Now, if it keeps failing, of course you can try again, but if it keeps failing and failing, it's a waste of corneal tissue. We still have something else we can offer.
Okay.
We call it keratoprosthesis, or it's an
What is
artificial cornea. It's like a bionic eye, a bionic cornea. It's an artificial cornea embedded in a human cornea. So it's a combination of artificial and human.
Okay.
And we do that also in the Philippines. No? These are for eyes where a regular transplant will really not succeed, most likely not succeed. And our results are very good with this keratoprosthesis also. So,
and everything that you've mentioned is done here in the country.
Yes,
They don't have to go abroad.
No, you don't have to go abroad anymore for this. It's all available sa Pilipinas.
Success rate, doctor, of the transplant.
Yun nga, it depends on the disease. For example, keratoconus, it's almost 100%. Maybe 90% success. No? But for, let's say, infection, no? With a lot of blood vessels coming in, the eye was nabutas na, the success rate goes down to about, 30%? Now, it depends on and sometimes you have to do a corneal transplant just to cover the hole. It's like a vulcanizing. Then we can use the not so good tissue that didn't really pass. They're safe but not so good quality. We use it as temporary. Yes, temporary. Basta hindi ka positive for any diseases.
Okay,
no?
even if the tissue is not good.
Not so good, basta hindi ka positive, we can still use it for these cases. No? Temporary transplant to get rid of the infection, to make the eye quiet. Then when it's quiet now, we can still do another transplant later on for vision naman. So these things can be done.
So it's a process. It's not just one entire process for the vision alone, but there's another.
If it's like that, it's called a therapeutic. It's for saving the eye first. Getting rid of the infection, getting rid of the nana, getting rid of the fungus. You know.
So parang first and foremost, save the eye first.
Yes. Then later on, restore the vision. That can happen also.
You speak about saving the eye. For those who do not need a corneal transplant, who do not have keratoconus
or any other problem,
with the eye, how do they take better care of their eyes?
Okay, good. That's a good question. Because one is, don't use unnecessary medicines. Okay, because people keep telling me, can I make this patak? Alam mo, sabi ko, if you have healthy eyes, your tears are your best patak. The tears were created to protect the eyes. They have antibodies, they're perfect. So if you don't need anything, why are you putting? So avoid unnecessary eye drops. Don't put eye drops which are not also for you. What is good for your friend is not necessarily good for you. Do not share contact lenses. No? And avoid, when you're going to do work that might cause, like tatalsik, welding, please wear protective glasses. Yun kasi may goggles, many may goggles, but they don't use it. Then they come to us too late na. Napasukan na ng bakal, napasukan ng dumi, napasukan ng kahit ano, because they just didn't wear their protective lenses. Simple things like that. No? And with computer use, rest every hour if you're going to use it for more than 2 hours a day.
Okay. Doctor,
simple.
Doctor, I know it's very simple, very easy to remember, but sometimes, we always forget. That's why, the show is here to remind everyone of those things that can keep our eyes healthy and strong and can help us focus and read and enjoy life. Doctor, we have a question from Facebook. Can LASIK correct problems with the cornea?
Yeah, LASIK. First of all, what is LASIK?
What is LASIK? Yes.
Okay, it's a laser procedure using a laser light to reshape the cornea. Usually used for people who don't want to wear eyeglasses or contact lenses anymore. You don't have any disease of the cornea like what I mentioned. No keratoconus, no real disease like dystrophy or anything. You simply have a refractive error, which I explained earlier. The light does not focus where it should. So when you have LASIK, it just reshapes the cornea. So if the cornea is, here we go, if the cornea is too steep, like in nearsighted people, too steep, it will flatten it, flatten this. If the cornea is too flat, it can steepen it by flattening the periphery. It reshapes the cornea. But with LASIK, we create a little flap, a very thin flap, not the whole cornea, a little thin flap. We lift it. If the cornea, you know how thick the cornea is? Can I open this again? No? The cornea is about 550 micrometers in the center. That's half a millimeter. So when you do LASIK, you create a flap that's about 110 micrometers.
Okay.
Then you lift the flap, then you treat the eye, and then you put back the flap.
Okay.
You don't lift the whole cornea, you just lift a part of it. No? Now, it treats refractive errors or abnormality or shapes the cornea so that you can focus light properly. But it does not treat those other diseases which we talked about. In fact, keratoconus is a contraindication to LASIK. If you have any suspicion of having keratoconus, you should not undergo a traditional LASIK or a regular LASIK. No? Okay? Although there are experiments now about cross-linking and then LASIK and cross-linking. But as a rule, as a general rule, it's not done. Okay?
Doctor, another question from Facebook. Can someone who has had LASIK surgery qualify?
That's a good question.
Qualify as a donor for a corneal transplant?
Yeah. Before, I would have said no. No? But again, now, because we have all these other kinds of surgeries where you can use the only partial thickness of the cornea, we can say okay. No? But to tell us.
Okay.
Tell us, because we don't want to be surprised. Like, how come thin the... Because when you do a LASIK, you thin out the cornea.
Yes.
And you have a flap. So when we have to know that in advance. Because we can use it, as I said, sometimes to save an eye from infection by partial grafts. We can still do that. So yes, we can accept it already. No? Similarly, before we would say na, if you're too old, you can't donate. Now, hindi na. Pwede.
Hindi na.
Pwede na. We don't even put an age limit to donation because of the many things we can do with the cornea na.
Okay. And the many things we can do, the many things we can still learn.
Yes.
And continue to learn upon your research, upon... also, with your patients, you learn so much when there's a transplant. Now, doctor, you discover so many other things when it comes to corneal transplant and understanding the eye better. So we'll talk more returns.
Did you know that award-winning actor Mandy Patinkin was one of those who needed a corneal transplant due to a degenerative eye disorder called keratoconus? Patinkin, who became famous for his role in the 80s version of The Princess Bride and other hit series such as Criminal Minds and Homeland, initially received a corneal transplant in his right eye, then underwent another operation for his left eye almost 2 years later.
We're back here on MedTalk, still talking about corneal transplant. Dr. Minguita, we've been talking about the advantages of getting a corneal transplant. Yes. What about those who opt not to have the transplant? How will it affect their vision and the quality of their life?
Yeah, okay. Some people really opt not to have it because one is they just don't want to have it. They'd rather just have one eye blind because you'll be only able to see well with one eye. So try doing that. Try covering one eye, or it's hard because you have no depth perception. Diba? You're sort of you're imbalanced, but you can learn to live with that.
Yes.
Sometimes if the cornea is very swollen, it can get painful. So some of my patients who don't want transplant, I just give them what we call the disposable contact lenses. We use them as like bandage lenses to keep them comfortable. As soon I just change them every month. That can be. But the vision will never go back to normal. You just have to resign yourself to poor vision in that eye. So it's an option. It's an elective procedure. You can just decide not to have the surgery and just live with one good eye. Now, if you
in the future, if you decide to have that surgery, is there a certain period that you have to decide?
It can still be done, but like in certain diseases, like there's complications after cataract surgery that cause the cornea to get swollen. It is said that if you wait for more than 2 years, then the success rate may also be less. It may be less successful, less chances of really, really good success. But that's in the traditional transplant. You can do now what we call the endothelial transplant, the one I told you about where we only change the inner layer.
Yes.
But also, if you wait again too long, hindi na rin pwede yun because masyado ng maga yung cornea. It can also cause scarring. So what happens is that your options also get less now for certain diseases. But if it's a scar, if it's a child with a scar who's less than 2 years old, then don't wait. Because you can already, if you wait too long, you deprive the child's brain of seeing through the eye, and he'll get a lazy eye. So even if you do it in the future, it might not be able to see anymore. So there are circumstances where you should do it soon, but if you're an adult and you have a scar and you're okay with it, then no need. No need to have it done. Just have to know that medicine will not cure it. No drops will cure it.
It can alleviate the pain temporarily.
It can alleviate the pain. If it's painful, you can have contact lenses if it's painful. If it's just a scar without any edema, just a scar, you can just live with the scar. You've seen people with scars.
Yes.
They live with it. It's okay. Sometimes they just use cosmetic contact lenses so that they look okay.
Oh, that doesn't irritate the cornea all the more?
No, you just have, hindi na. If it's a scar, it's a scar. And some people just are happy just to look normal. Diba? Even if they don't see, as long as they look normal, that's fine. So it's really an option. It's elective.
How about the options of protecting one's eye after a corneal transplant? What should we do, the do's and don'ts?
Again, do not rub your eyes. Do not engage in really rough contact sports because if that gets hit, it can damage the graft. No? At any earliest sign of anything abnormal, we tell the patients to see your doctor right away, meaning if you develop redness, pain, irritation, then don't wait because it could be an early sign of rejection. Because if rejection is happening and it's addressed early, it can be reversed. It doesn't have to proceed to another transplant. You can actually reverse it just by increasing steroid drops, etc., etc. So see your doctor at the earliest sign of anything that's not ordinary. Just do that. So simple things like that.
How about checkups? Simple thing is a checkup. How often should one visit their doctor?
Okay. Usually right after, the day after, every week, then becomes every month, then every 3 months. It gets less and less, but I would say at least every 6 months. Because it's still a transplant. So it's still tissue that it's not yours. No?
Okay.
The longest successful transplant I've had as a patient is 17 years, still going. But not everything lasts that long. Okay? And that's keratoconus, is the longest lasting transplants. They're the most successful, keratoconus.
So in the 17 years,
it's still okay.
Still okay. The first, the cornea that has been replaced is still the cornea.
Yes, still there, yeah.
Okay.
So it can last very long, but it can also last only a year if it's really bad, no? Especially if you have other problems like glaucoma, or as I said, or else the eye is so inflamed, it's very dry. Or you don't put your medicines.
These little things, these simple things that we forget, and then pag malala na, that's the time we run to our doctor.
Or they don't have a checkup, they'll only see you when there's a problem. You know? Those are the things that might lead to an early failure of the graft. You know?
You mentioned failure. I have to ask this because in our kind of work, we're always exposed to a lot of lights where we have to face the camera.
Yeah, I know, like here.
Yes, our eyes tend to get dry.
Yes.
And what can we do about that? Because sometimes I personally notice dancing letters.
Yes.
And you worry if that's astigmatism or something else.
It could just be dry eyes, simple dry eyes. Because when your tears dry, when the surface is not, then the surface becomes not smooth. And when it's not smooth, then it gets malabo. So sometimes you just blink and it feels better because the tears again bathe the eye. But I would suggest to people like you to have some drops. You know, the proper eye drops to sort of prevent the dryness. You anticipate it, you preempt it, so it does not happen.
So always keep our eyes moisturized.
Because yes, every time you feel that it could be your eyes are getting inflamed a little bit, and it makes it more dry. It's like a cycle, a vicious cycle. So you try to break the cycle by preempting it na.
Okay, and this one we won't preempt because we need to know and we need to be encouraged, Doctor,
Yes.
as the president of the Eye Bank Foundation, how we can donate. Again, we can't stress the importance of donating.
So those who are out there, please help us. You can just call the Eye Bank. There are many ways to donate. If you want to help us, you can call the Eye Bank at 302-6282. Then you'll tell us you want to, or check out our website, eyebankphil.com, Philippines, PHIL. And there are the numbers on the screen.
Oh yes, there they are.
There we have a hotline also. So 302 Mata, that's in PGH. Then we can send you the donor form. Or if you have driver's licenses, please do look at the back of the license and sign. And let us know also in the Eye Bank, no? And tell your loved ones that you want to donate. And if at a certain point in your life, or maybe now you're listening, you have a loved one who's just passed away, or you feel is going to pass away or something, or talk about it, because sometimes you don't know they want to no, they want to, but nobody asks. And when the time comes also, if you feel that the person would have wanted to, you can also donate. Almost all hospitals will know how to contact us. There are some hospitals where we are more active, St. Luke's, East Avenue, Hospital ng Maynila, Makati Medical City, so many hospitals. But in any hospital, just say, I want to donate, can you please contact the Eye Bank? Makakaabot yun sa amin. No? It's just a matter of, like what Ali did, I just hope more people will be like her. Because it's difficult. It's difficult. But as she said, it brought meaning to the death of her son, and it actually helped her in the grieving process. Because you feel that kahit papano, you also helped others. No? And one last word, Saint John Paul II. He's now a saint now. He actually made a speech in the year 2000. He referred to organ donation as a genuine act of love and a genuine culture of life that we should encourage. So since he's a saint, I hope even the church will start to encourage people to do this. No?
And it's an act of love and kindness that
It
you
is.
have to donate, and that you're here to help us understand it more and to encourage all of us to donate.
Yeah.
I mean, for the lack of another word.
There's no other word.
That's it.
And it's hard because all of us will go one day. I think keep telling people, all of us will pass away. This is not our permanent life. But how come nobody wants to think about it? Very few people are willing to say it, think about it. No, like me, I have a donor card. I have a will. So some people are superstitious. They think if they sign a donor card, they're going to die soon, or they have a will, they're going to die soon. Of course not. I've had my will for a long time. I've had my donor card in my wallet for a long time. But it's something I want to do. Di ba? Sana ganun na lang. Kasi at least part of us will live on. Even if we're not here. Part of us continues to live, and we're helping others.
And our family knows that somehow we've saved someone else's
whether it's
life.
their sight, their quality of life, or their life, no? And assurance, if you donate your corneas, it will not disfigure you, huh? You ask Ali, Miko had an open casket, very nice. Cesar Montano's son, si Angelo,
also donated.
eyeballs.
Okay.
The son of Tony Rose Gaida. You can ask all of them. They all had open caskets. They looked very handsome, very nice, very natural. So don't worry about that. We can all look nice in our caskets, even if we are donors, even if we are cornea donors. So
Thank you very
important.
much, Dr. Mingita. It gives hope, it gives life, it gives a more positive attitude into donating and helping others. Thank you once again for being here and for sharing your time with all of us.
Thank you, Angel. Thank you to everyone.
See you again next Tuesday, 7 p.m. on your scheduled on-air consultation here on the Solar News Channel. This is Angel Jacob. Good night, everyone.